All right. Chapter 7, Skeletal System, all about the bones. We're starting on page 63. The anatomy of the skeletal system. Okay. Again, the skeletal system consists of fused as well as individual bones. Underline that. They're supported by tendons, ligaments, muscles, and cartilage. All that got to work together. Also, the skeletal system supports other organs and protects. All of the things we know that they protect. Bones are this type of connective tissue that is impregnated with inorganic salts. They are impregnated with what?
Inorganic salts.
So organic makes up how much?
1/3.
And inorganic salt composed of?
2/3.
So 2/3 of your bone is inorganic salts. And they are responsible for hardness of your bones. And as we already know, it's all about protecting. They're very strong and protects your vital organs. If we didn't have ribs, our lungs would be tore up. If we didn't have a skull, we would probably not be here today. I'd have been dropped. The babies are terrible at dropping. If they didn't have a skull, we'd be in trouble. We'll probably be in jail because they fall all the time. Poor babies. There are different types of bones. They're characterized by their shape, development, structure, or region. It's just where they come from, and labeled at 1, 2, 3, 4. Basis of shape, development, structure, or region. Meaning, is they long and short bones, flat bones, irregular bones, just the shape of them. How they developed and what they're made of. And the basis of structure, which is compact and spongy. And those are your two structures for your bones, compact and spongy. And then region, just where do they originate? Where do they come? Where are they at? The basic structure of bones. The typical bone, which is a long bone, has two important parts. You've got the shaft, which is the middle part. They also call it the medullary. Or I should say the shaft is the middle part of the bone. Within that is the medullary cavity. When you eat chicken, you know the stuff in the middle, that's medullary cavity. Periosteum, that's the thick fibrous membrane that covers the bone. Underline that word. What covers the bone?
Periosteum.
Periosteum, depends on who's pronouncing it. Underline, star, the medullary cavity is the central part of the bone and is filled with yellow or red bone marrow. And it ends up being very productive, very what we need. Ends of the long bone, so you got the shaft and the ends, is mostly calcaneus or calcaneus, however they say it, but it's the spongy bone, spongy bone. Spongy bone, that's the end. The blood supply of the bones. I don't want you to go digging. I just need you to know the names of the blood supply to the bones. You've got the nutrient artery, and underline that first sentence there. The artery enters the shaft through the nutrient foramen and runs through the cortex. Just know that it's supplying the bone. Nutrient artery supplies the bone. So does the periosteal artery. Of course, you know, that's what's going to, periosteum covers the bone. So you've got one going there. The epiphyseal artery as well. Epiphyseal is just part of your bones. And the metaphyseal arteries. So that's what I need you to know. The blood supply of the bones comes from the nutrient artery, periosteal artery, epiphyseal, and metaphyseal arteries. Okay. The nerve supply of the bones. Of course, when bones break, we feel that, and it hurts. And so bones actually have peripheral nerves as well, and sensory signals come from the bones. So that's why we feel bones are broke, it hurts. And underline, this is the law. This is like, you got to know, according to Hilton's law, which explains the pattern of innervation of bones by peripheral, says that the nerve that supplies a muscle is also supplying the underlying bone. Same as what I was saying, you know, how they name and label things. Same here. If one nerve is going to that muscle, it's probably innervated by that bone as well, or to the bone. So the nerve that supplies the muscle is also supplying the underlying bone. Learn that. Hilton's law, the nerve that supplies the muscle is also supplying the underlying bone. Okay? Also know the innervation of nerves has the following characteristics. What I want you to really become familiar with is your sympathetic and vasomotor. Sympathetic and vasomotor. Just remember that. And some of the nerves are sensory. And we've already said that. That just means that when the bone breaks, we feel it. We know it. Sensory, pressure, all that. We feel it. Cell types in bones. Again, just like we had for our muscles, it goes for your bones, of different kinds. So an osteoblast, remember I said blast is always like the start of some type of cell or something. It's going to start there. So you got an osteo means bones, blast, building. So bone-forming cells that descend from osteoprogenitor cells. All you need to know is that's what it starts from. That's what bones start. It's like the mother cell of a bone, osteoblast. Come on down to where it says osteoblasts are immature bone cells that eventually become caught in the bone matrix and become osteocytes, which are the mature bone cells. So we're going to osteocytes, which are underlying the mature bone cells. And underlying that last sentence, functions include the formation of bones, maintenance of the matrix, and homeostasis of calcium. Calcium plays a big role in our bones. Osteoclast. Anything you see with a clast or a phage or something like that, that means a breakdown. So that's the opposite of osteoblast. That's the building of, whereas clast is the breakdown. So underlying cells responsible for bone reabsorption and remodeling. Responsible for bone reabsorption and remodeling. And that last word in that little paragraph there, phagocytic. Phagocytic always means like eating. That's kind of the words we use for phagocytic. Ossification of bones. Underlying ossification definition is the process by which a bone is formed. We got all kind of things happening. We got membranes, we got cartilages happening. Don't dwell on that. But we need to know the definition. Ossification means making bones. The function of bones. Now we're going to break this down. A, B, C. You got your mechanical function. That should be an A or a 1, however you want to do it. Synthetic, which should be B or 2. And then metabolic. And you need to know the differences of what they are. The function of a bone. So it's got the mechanical function. Of course, we already know protection, movement, shape. Mechanical. Then we have synthetic. Synthesis of blood cells. Makes blood cells. And also in there, bone stores bone marrow, which is able to produce blood cells. So the bone marrow inside is producing your blood cells. And then metabolic, and they break this one down really well. What are your metabolic functions? Fat storage, mineral storage, and acid-base balance. Fat storage, mineral storage, and acid-base balance. That is your metabolic function. Know the difference between synthetic function, which is the blood cells, your metabolic function, which is fat storage, mineral storage, acid-base balance. And what are those minerals that it's going to be storing? Calcium and phosphorus. Those are some main ones. Keeps bones hard. Okay, come on down to cartilage. Underline and know this definition. Cartilage is a connective tissue which is comprised or composed of cells known as chondrocytes together with collagen or yellow elastic fibers. It's a connective tissue composed of cells known as chondrocytes together with collagen or yellow elastic fibers. So what makes up cartilage? The first thing is chondrocytes. They're all connective tissue. All your bones, muscles, everything is a type of connective tissue. That's just a wordage to call your tissues. But they're composed of cells called chondrocytes together with what? Collagen or yellow elastic fibers. Okay. Cartilage itself is not hard like bones are, but it is more flexible. Underline more flexible. We know that. We can bend our ear, we can bend our nose. It doesn't stretch, but it bends. There are 3 types of cartilage. You got your fibrous, hyaline, and elastic cartilage. Just know that you have 3 different kinds. Underline the characteristics of cartilage. No blood vessels or lymphatics. It's just there. That's why it's so hard to heal. When you break your nose, people's nose tend to stay broken. Mine is actually broken right here. But I guess it comes back together, but not the way it was. I got hit by a patient, right? Just like that. But no blood vessels, no lymphatics. Slow healing process, underline that. That's just how it happens. They got a slow healing process. Because there's nothing in there, supplying it. Then underline that last sentence. Calcium salts are not present in the cartilage matrix, but chondroitin is, which is the flexible material. They don't have calcium salts, because remember, calcium salts make it hard. So they do have chondroitin, though, which is a flexible material. And you hear a lot of people, if they got good knees, or an older lady might say, I take my chondroitin. That's why I got good knees. One lady preached on chondroitin, but it's a medication you can actually buy. It's that Walmart. But it actually helps your knees in the long run. Page 68, we're going to go to our joints. A joint is defined as a junction between two or more bones or cartilages. Underline it. Normally we think of two bones, but it's also between cartilages as well. Joints permit the movement of hard skeleton structure of the body. So permit the movement. What do joints do? We know. It's just they're putting it in the words. Provides movement or permits movement. And again, in the way that joints are formed, they are able to keep a balance between stability, movement, and strength. Underline that. Joints keep a balance between stability, movement, and strength. And some of this you already know. They're just putting words to it to make it sound more medical. You know what joints do, but we need to know the words. Types of joints. You got your functional, structural, and regional. That's another 1, 2, 3. But it's the same as bones, just as well. Functional. What does it do? Are they immovable? That's exactly what they mean. It's immovable. It's fixed joints with no movement. Underline it. Partially movable. Sometimes they can move. It's more like a pad of cartilage that lies between your bone surfaces. That's what a lot of people, when they say meniscus got messed up in their leg or in their knees, that's that joint. But that is what's messed up. So partially movable, you can bend your knee this way and this way, but you can't bend it this way. If you bend it that way, you in trouble. And people get their legs bent that way and they mess up their knees. But that's your partially movable. And freely movable are called synovial joints. That's more like your shoulder. That's a synovial. And you can just move it anywhere you want to, up, down, round, backwards, forwards, all the above. Okay? Or it can also be structural. You got your fibrous joints, which is joined together by fibrous tissue. And then your cartilage joints. Cartilage joints. That's where the cartilage is between the bones. And then we're going to go to regional. Where is it located? Skull, vertebral, or limbs. That's all your definitions or your types of joints. We're going to type it by its function. We're going to type it by its structure, how it's made. And then we're going to type it by where it's at. So all that's trying to get you to know. Then we have connective tissue. And everything is really part of your connective tissue. We just break it down. Underline this, though. Connective tissue is spread all over the body, but a special type of connective tissue forms other tissues, such as bones and cartilages. They're everywhere, everything. Because that's just what it is. The connective tissue are connected, and they make a tissue. Cells of the tissues, you got your fibroblasts, macrophages, plasma cells, mast, fat cells. What we are talking about as far as bones is fibroblasts. Again, fibroblasts, osteoblasts, very much the same. Intracellular matrix, just underlying collagen, elastin, and reticulum. It's just what's on the outside, what's making up that bone. Or, your bone, sorry, cartilage. All of it. Let's talk about our ligaments. Ligaments are fibrous branches that connect adjacent bones to bones, which makes a joint. Ligaments are bone to bone. They are sturdy. They are flexible. You can mess them up as well, just like anything. Types of ligaments, and they break it down to the composition. Is it collagen or elastin? So underline collagen or elastic. That's the composition. Is it collagen or elastin? According to the relation in the joint, you got your intrinsic ligaments, which will be more inside. Extrinsic ligaments, which were away from or outside of that muscle. You think of, or joint, sorry. You think of your knee. You got some inside and outside. That's all they're saying. The ones that's closer to the bone to bone is actually your intrinsic. Outside is extrinsic. Don't think too hard. It's just N and X means in or out. Okay. Page 70. You got your axial skeleton and your appendicular section or skeleton. So axial. What if you're on an axis? What is that? What's our axis of our body? Right through the middle. Your skull, spine. That's it, really. Vertebral column. So underline that. Your axial skeleton consists of skull, vertebral column, and thoracic cage. Your ribs. That's coming in there too. So your skull has 22 different bones, and it's composed of your cranium, which is the skull, and your face bones. Then your vertebral, you got 33, and they're separated as well. Cervical, thoracic, lumbar, sacral, and coccygeal. We kind of touched on that, but they're just going right on over it again. Got your cervical, thoracic, lumbar, sacral, and coccygeal region. And then your thoracic cage, a bony cage that encloses organs in the chest area. Just write chest area over there somewhere so you can get that. Thoracic cage, all of that is your chest. Oh, and it says it there. Located within the chest. And how many ribs we got? 12. Don't forget that. Your appendicular just means everything else. Your appendages, what is attached to your axial. Everything else is your appendicular. Axial, right there in the middle. Everything else is appendicular. So you got your shoulder, girdle is what they call it. Shoulder is attached. Then you have your upper limbs. You know you got your arms. There are 30 bones in the upper limbs. And how many bones in your lower limbs? I skipped on down, but how many bones? 30. So 30 in your upper, so that's your arms. 30 in your lower, which is your legs. Then you have your pelvic girdle. That's composed of several bones. They describe it, but that is your pelvic girdle, and that is makes your hips, all that good stuff. That's what you have to work around when you're having babies. That pelvic girdle. Skeletal of the upper limb. How many bones?
30.
How many of them in your lower limbs?
30.
All right. What is the functions of the skeletal system? They're just going over it one more time. Strength and support and shape. So underline that. Strength, support, and shape. Of course, protection from vital organs, leverage for movement, and they want to break down the production of red blood cells. That's where it's happening, right there in their bone marrows. Underline, bones like the sternum and tibial heads have hematopoietic activity, which is blood cell promotion or production. Underline, hematopoietic means blood cell production. And it's happening in your sternum, tibial heads. A lot of times that's where your new blood cells are being produced. Okay? So they just kind of reiterated what they said earlier. Bones and joints of the skeletal system, just go over that. Y'all know where some of this stuff is. If you don't, we're in trouble. Your clavicle is always that collarbone. Scapula is your shoulder bones. Radius, we know that because what do we check? Radial pulse. Ulna is the other side. Carpal is all them little things in your wrist. Your lower limbs, you got the big one, which is your femur. If somebody breaks their femur, you need to be concerned because they need some help. Tibia, that's up under here. And your thoracic bones, that's the sternum and your ribs. As far as your joints, they kind of go right on together. Sternoid clavicular joint. So guess what it joins? Sternum and your clavicle, which is your, oh gosh, what's the other name for this? Collarbone. So it is a joint that connects the two. Your hip joint, knee joint, ankle joint. There's some kind of song. Something that's connected to that song. But just flip on over to radiography. That is page 73. Know your different types of radiography, and you're going to see that. That's your radiology. That's your X-ray. And that's the department you may work in. As a CMA, you may be the one that gathers them up, dresses them, tells them where to go, takes the information, and then your X-ray tech is going to do the X-ray work. This technology is often used to determine medical conditions regarding bones and joints. We know that. It's taking a picture of that. Hopefully, they won't tell us that we done broke a bone or something. Diagnostic radiography refers to radiography where both ionizing radiation and non-ionizing radiation are used in order to create images for medical diagnosis. Long definition, but you need to know it. What is diagnostic radiography? It's both ionizing radiation and non-ionizing radiation that creates images for medical diagnosis. And we know that. We're just adding the ionizing part to it. We already know it's an image. And the doctor's going to use it to diagnose something, but we're adding ionizing and non-ionizing radiation. Okay? The X-ray is the second most commonly used medical test after lab tests. So after phlebotomy, then comes X-rays, as far as what's happening, helping people diagnose. So X-ray is the second most commonly used medical test. And when you do take an X-ray, you know, it comes out in old times. Now it's computerized mostly. But they still do the X-ray sheets. But to prevent X-ray film from exposure to stray X-rays, we're going to store it in lead containers. So to prevent the X-rays from getting messed up, what are we going to put it in? A lead container. It's just something lined with lead that would not let all the other stuff, because those are ionizing radiation. That means something ionizing, plasma negative stuff can mess up X-rays. So you got to be careful with your X-rays, putting them together. Diagnostic radiography also has subcategories. So diagnostic radiography is everything. Then it goes into your subcategories, which is projection radiography. Put a 1 there. So underlying diagnostic radiation or radiography, that should actually be like a total bold thing. And then up under there comes your projection, fluoroscopy, dual energy, and computed tomography. That should be your 1, 2, 3, 4. Projection, fluoroscopy, dual energy, and computed tomography. And they're all up under diagnostic radiography. So far as your projection, it is creation of images by exposing an object to X-rays and capturing the shadow as a latent image. So projection means capturing the shadow as a latent image. So that's what I did. You can see soft tissue, dentals, mammograms. Most of them, that's what the kind of radiography they're going to be using. Then you got your fluoroscopy. It's the moving projection. It's when you're moving. They want to see the movement of your joints, movement of body parts, so they'll know exactly what's going on with you. They call that fluoroscopy. They also use it for joint repair or replacement, angioplasty. That's them going and looking in your heart and arteries. And pacemaker insertion. That's what they're using because they can see. They're using radiography to put something in your body, and they actually follow it through your valves. They can see everything hard. They can see when they put in stents in your heart. This is what they're using. Dual energy X-ray, primarily used for osteoporosis. Y'all know what osteoporosis stands for? Osteo is bone. Porosis is holes in your bones. Porosis, pores. Osteoporosis. There's holes in your bones. And that's what it's normally used for. That's a different kind of test that's showing if your bones are hard or see-through or not. And that's what that dual energy is used for. And then computerized or computed tomography, which is a CT scan. And a lot of y'all know y'all have had that. And a lot of times they'll do a CT scan on you real quick. Like, it's high amounts of ionizing radiation with a computer image. That's what it is. Computed. That's what it means. It's on the computer instead of on your X-ray films. They put it on a computer. And they call it computerized tomography. And normally it's very short. They take this and this and this and this and that, turn right, left, upside down, and then you're done. Also, this is what I want y'all to look up. This is homework. Look up what a pilogram is, a brachiogram, and a GI series are.
Can you say it again?
Pilogram. Write that down.
Say polygram.
Pyelo gram. And that's going to be kidneys. Anything pylo, that's the stuff in your kidneys. Bronchiogram, guess what that is? Lungs. And the GI series.
GI series.
Gastrointestinal series. They are all types of X-rays.
Spell the first word.
Yes, I want y'all to find out, is it used in is it X-rays or is it not?
Spell the first one again for me.
Pyelo gram.
What does that do? Tuesday?
Just that's for your information. You're gonna have a test question on it, so you ASAP. Just put it in your learning. And I don't know why they didn't add them. They're still. And know what a bronchoscope is. Add that too.
Who?
Bronchoscope. What you reckon it is? It's broncho.
Scope that goes in the lungs.
They're looking. They're looking in there. They actually got a little thing that has a camera on it, and they're looking at your bronchial tubes. So here are your diseases of your bones. So, page 74, you got your osteoporosis. We talked about it a little bit. Osteo meaning bone, porosis meaning holes, or I think pores, so osteo with holes. Underlying is a disease of the bones that leads to an increased risk of fractures. What is a fracture? A break. A lot of people don't realize that fracture just means break. It's that next thing, reduction of bone mineral density. Something happened where the hardness of the bones is not there. Also common in women after menopause and postmenopausal peoples. Underline that. Especially ladies. Well, only ladies for postmenopausal. But it's something to do with the hormones that work together and that help make the strongness of the bones that doesn't happen when you're menopausal. Underline that last sentence, how we're going to treat it with biphosphonates and other medical treatments. Biphosphonates is actually what we're missing. It's part of the calcium salts or the inorganic salts that we need to make that bone stronger. So they're going to give you biphosphates. Normally it's a shot once a month. When they give that shot, you might have to do that. They may come in to get that once a month shot. And you have to let them sit down for at least 30 minutes to an hour. They can't move. It does something to them. I don't know, but they will fall out. So they'll tell you, just get the shot and they can't move. Osteogenesis imperfecta. Very similar to osteoporosis, but a whole lot worse. It's called brittle bone disease. Children are a lot of times born with that. Everything they do is break a bone, break a bone, break a bone. Somebody got to go check them. Something's wrong, and they can try to fix it. But it's the symptoms are weak bones, and they are very susceptible to fractures. Weak bones, of course, weak bones break. Other symptoms include multiple bone fractures, a blue tint in the whites of the eyes, early hearing loss, even the little bones in your ears. They're very bad. Bowed arms and legs, they're the one that gets they're really bow-legged. Something happened, they didn't have the hardness in their bones, and they get really, really bow-legged. Some people are just naturally bow-legged, but this is where it's not a good thing, where they eventually, as they grow up, will mess up their back. Kyphosis, that's that where they lean over, the bones are not as strong as they should be, and they tend to start going like that. A lot of tall people. Kind of like scoliosis. Yes. Kyphosis is more just at the top of you leaning over. You see a lot of taller people, their bones are actually, some are hard, and I'm not gonna generalize, but a lot of times the stretching of all that actually made their bones weaker, and they break easier. And they're the ones you know that not only are they tall because they're tall, or they're leaning because most doors. I'm talking about real tall people. Doors are low or high or whatever, but they tend to do this also because all their friends are shorter, and that's where that kyphosis comes. It's the curvature, like you're leaning over, and or scoliosis. Yes, that kind of stuff makes you want to sit up. There's no cure for it, but again, what we're going to give them for treatment? Biphosphonates. Same thing as osteoporosis. We're trying to make the bones stronger. That phosphorus, all that makes bones stronger. Then bone fractures, it is a break. Just underline it's a break. They make it all fancy. Break in continuity of the bone, but it just means a break. You can also have different types of fractures. You got your closed fracture. That means it's still in there. It didn't go through the skin. If it goes through the skin, what we're going to call it? Open fracture. And that is the worst for infection. You can break a bone. It's a good thing that it stays in there. But once it comes out, bones, because everything that's going on, the bones, what the bones do, they make blood cells, all that good stuff makes it very susceptible to infection. That's why you don't, surgeries for, they go wrong a lot. Foot bones. They go in there and fix the foot bone, but, next thing you know, they got some kind of infection going on with the foot bones. And I would try not to have, if you don't have to, them foot surgeries can lead to loss of some function of that foot. Or it could fix it wonderfully, but I'm just scared of it. I broke 3 bones, and he was like, well, we can fix it right now and go to surgery. I said, no, give me a cast, please, and let my bones fix on their own. Don't mess with my bones, because that is open for infection, just like that. So you got to watch out for your bones. Don't want them exposed or messed with. A lot of times they put you in a cast or sling. Sometimes they put you in surgery to fix it. My baby, she had got ran over by her brother, and he jumped in the car and tried to drive the car. And she's running behind the car, having fun. And got straight ran over, and it ran over her whole leg, broke her leg, her foot, and they had to do that. Where they wasn't, they didn't want to cut on her. They don't like to cut on you. But they did do a little small cut in the top of her foot. But they try not to, because that's bone, and it's broke, and exposing bone is not good. We're always worried. They're gonna pack you full of antibiotics, because that's some real stuff happening there. But they gave her that medication that makes you not forget. That does not mean you're not in pain. You talking about hollering and screaming. She went to trying to fight them people while they was trying to set her bone back right in her foot. And I seen it. They had this and pulling on it, and she's hollering and she's trying to beat them up. No, they just set it in place. Yeah. But they consider that knocked out. You're not gonna remember it. About 15 minutes later. You come back around 30 minutes, you know you've been tampered with, and it's going to be a back hurt, but you're not going to remember that straight pain. I forget the medication they call it. But it it doesn't really put you out. They need you there. They don't want to put you out. So they give you that, which is crazy. And she was hollering and everything, and I about couldn't take it. I'm going to beat y'all up. But she tried to beat them. They had to hold her down. Yeah. You could have a dislocation of your joint. That's all it means. Underline abnormally displaced. A lot of people's shoulders, their ligaments are not all that they should be, and their shoulders will pop out. And I actually could do mine if I force it. But I'll pop my shoulder muscle a lot. My shoulder right here. But normally it's dislocated because of some type of trauma. But how we're gonna treat it? We're going to just pop it back in place. forcing the joint back into its normal location. That's how we're gonna fix that. A sprain, what's a sprain? What are we messing up?
Your muscle.
A sprain is what?
Ligament. The joints, right?
It's all that's joints. We're talking about joints, I think. Yep, joints. So the ligament is what? What do we call a ligament that messes up? There you go. A condition caused by overstretching joints beyond their capability. It actually is a sprain of the ligaments. Diagnosis made by physical exam, and we give you anti-inflammatory meds because that's what's going to happen. Not a lot that we can do. Compression, rest, and elevation. Underline that. That's how we're going to fix that. Hopefully it doesn't happen because they're hard. Ligaments are harder to heal than tendons. Arthritis. Inflammation of more joints. Y'all know that one. Itis is a swelling. Artho means joints. So inflammation of one or more joints. There's no cure. What we're going to do for it? Physical therapy or medications. And that fancy word, I need y'all to know what it is. It's called diathermy. And just that therm in there should get you there. It's messing with temperatures. So it's a therapeutic generation of heat in body tissue, commonly used to treat arthritis. What's common therapy for arthritis? Diathermy. Or you may have a neuropathic joint.